All right, so we started our recording. I'm going to share my screen with you guys. Just let me know. Can you guys see the PowerPoint?
Yes, we can.
All right. So welcome everybody to the ACORNS Introduction webinar. We're going to have a lot of time for questions here. So this is where we're going to try to address some of these things, but my computer's frozen. Aha. Do you see the?
Yes.
Okay, thank you. Sorry, I've been having some issues with my computer today, some corrupted files, so hopefully this all goes as planned. So we want to introduce the ACORNS team. Do you want to take it from here, Julie?
Sure. Good morning, everyone.
You're on mute.
So good morning, everyone. My name is Julie Villa. I am the health education specialist here at CRIB working on the ACORNS project. I will be your main contact person in the event that you have any questions or concerns or any TA requests throughout the ACORNS project. Once I receive those TA requests, which I did send out to you guys in each of your emails. So if you could fill those out and send those in to me, and then I can disseminate them out to whoever I need to in our team. I have been with CRIB for the past 20 years, working on numerous different projects. I'm also a Europe tribal member, so I do come from a very rural area, and so I'm very familiar with rural settings as well as the urban settings. And I just like to welcome all of you. I'm very excited that you guys are, we finally connected through all of the emails and whatnot. So welcome to our team, and I would like Mr. Ephraim to introduce himself.
Hello, everybody. My name is Ephraim Lopez. I'm a health education specialist here at CRIB. I was on the last round of the ACORNS program. Some of you guys did what was previously a site program, but they were kind of a joint program. So I know some of you from that adventure we had together. So I'll be on this round of ACORNS, and I'm happy to be on this project with you guys and to see some friendly faces and some new faces. I'm gonna pass it over to our either our evaluator, Fareen Farouk.
Good morning, everyone. My name is Fareen Farouk. I am the program evaluator for ACORNS this year. I've been here for about 3 months now, so everybody's new to me, but I'm really excited to work with all of you. And if you have any questions for anything, send Julie a TA request and I will be there to help you. I think Kathleen is also on this call. So if we could have our program manager introduce herself. Kathleen?
Mute yourself, it'll go off.
We can hear you.
There you go. Okay. Good morning. My name is Kathleen Jack, and I'm the Deputy Director of the Research and Public Health Department here at California Religion Health Board. And a lot of you that have been funded before, I don't know that you fully were ever shared the structure. So all along, even though you never see me, I've always been the project director of the ACORNS grant, but definitely this is a program that is run by the ACORNS staff, and I'm just here to kind of help and assist them keep moving and go through administrative processes here at CRIB. But right now, as you can see from our ACORNS team, we are missing our project coordinator. So I am also serving as that in the interim until we fill that position with a new staff person. And so I'm just excited to, I've looked at all your grants and applications, and I'm excited for the year to start.
All right, thank you for that, team. I believe Carol Maida might also be on the call. If she'd like to just introduce herself.
Can you hear me?
Yes.
Great. Hi, everyone. I am the planner grant writer for CRIB. I may have worked with some of you in the past, but I'm here to provide you with any of the assistance that you might need regarding program development, revision of your plans, grant writing, anything along that line. So as we go along the way here, I hope that I'll be able to address some of your questions or in the future address your questions. Thank you.
Thank you for that, Carol. All right. So let's get started with your guys' introductions. There's a lot of friendly faces here and a lot of new ones, as I mentioned earlier. If you guys can please just, I guess, one at a time, or however you like, maybe Julie might call out the people on the call. I can't see all of them in presenter mode, but what we really need is your name, where you're from, and maybe your project role.
Okay, so if we could go ahead and start with Toyabe, Miss Marjorie Neer. Or Miss Melissa Kilgore.
Hi, good morning. Melissa and I are here listening, and we're going to have to get something that so you can see our face next time. And we are just hearing about receiving the grant, so we're very excited about that. I am the public health director here at Toyabe, a nurse practitioner. We are focusing on the strategy 3, with diabetes prevention. It's something that we've worked on in the past, but have kind of lost our momentum with that. So we're excited to implement some new things and revitalize what we've been doing.
Nice, thank you, Marjorie. If I can have Miss Janice Mendez.
Good morning, Janice Mendez, Bridgeport Indian Colony. My title is going to be the project coordinator for our colony here, focusing on diabetes. I'm very excited about it because we don't do a lot of interactive things for the community here. So expanding opportunities to build awareness and hopefully prevent, further complications, and targeting people to get activities going and all of that. But my big worry about it is going to be getting the people to come out and really be concerned about their health, and then hopefully engaging more people to participate and getting the community involved, and then finding out what do they want to do to make this project better. Okay.
Thank you, Janice. If I could have Miss Wendy from United Indian Health, please introduce yourself. Are you on the line, dear? Okay, so we will move on to Riverside. I do see Holly and Daniel on.
Hi.
Hi, how's it going?
Awesome.
Awesome.
If you guys can give a brief introduction.
I'm Holly Browner. I'm the diabetes program director.
You have some pretty bad feedback on your end. I went ahead and muted you guys. You guys can enter it in the chat, but I feel like there we go. Something happened. Huh.
Okay, so I will introduce him. So Miss Holly Bronner, she is from Riverside, and Mr. Daniel Meza also is on the line. Just give a, and welcome you guys. And I think maybe it's because we're moving too close maybe to the audio.
I think we got it fixed. Can you guys hear me now?
Yes.
Okay.
Perfect.
My name is Daniel Maza. I am the fitness specialist for the diabetes program over at Riverside, San Bernardino County Indian Health.
And I'm Holly Bronner. I'm the Diabetes Program Director at Riverside San Bernardino County Indian Health as well. We're really excited about this project. It's going to enable us to really start a lot of new classes and prevention programs for our patients.
Thank you, you two. If I could have Miss Jennifer from Sonoma County Indian Health introduce yourself.
Hi, this is Jennifer Burnett. I'm the public health nurse at Sonoma County Indian Health, and I will also be the project lead. And we're going to be focusing on CHRs and supporting heart disease and stroke prevention, more specifically hypertension.
Thank you and welcome, Miss Jennifer. Next, how about Miss Jennifer Gagliano from Greenville? Jen, are you on?
Here we go. Sorry, guys. Yeah, good morning. My name is Jennifer. I am the CHR supervisor here at Greenville Rancheria. I'm also a CMA. I'm the project lead. And then let's see, what I'm excited about is definitely the opportunity that this grant brings us for the clinical and community linkage. I'm always excited to work with our community in that way. And my worries are nothing because I have ACORNS backing us, their team. So it's all good. Thank you.
Welcome, Jen. If I can have Santa Ynez introduce themselves.
Yeah, it's Ron Sasan at San Ynez Tribal Health. I'm sitting in for the medical director who's out today, so I'm just listening in. Thank you.
Thank you. Now, if we can move on to Bishop. Sabrina, I see you're on. Can you ladies hear me on there? How about we move on down to Big Pine?
Good morning, everybody. My name is Lorena Levine, and I'm from the Big Pine Wellness Center. I'm taking the role of project lead. I'm a wellness center monitor here. And I'm excited to work with our diabetic clients. Something that worries me, though, is that we won't be able to, actually get them into the center, but we're going to try our best. So thank you.
Thank you, Lorena. I know that I saw a 707 number call in. Resigini Rancheria, are you guys able to get on today?
Julie, this is
Yes.
Fawn. Hi.
Good morning.
Can you hear me?
Yes, I can, dear. Can you introduce yourself?
Yeah.
Dear?
Yes. Good morning. This is Fawn Murphy, Tribal Chairperson, Resigini Rancheria. And I believe Megan Van Pelt is also, she's our Executive Director. I believe she's on. We're in separate locations. We had a power outage this morning. Our electricity just came on a few minutes before this, but we're very pleased and happy to get notification that we received the grant, and we will be focusing on obesity and type 2 diabetes prevention with a focus on the youth and incorporating and collaborating into the community. So we're really excited.
Nice. Thank you, Fawn.
You're welcome.
So if we can go down to Lone Pine.
Manahu, my name is Mariah L. David. I am the wellness coordinator for the Lone Pine Paiute Shoshone tribe. I am Big Pine Paiute, and I am an enrolled member with the San Carlos Apache tribe. What excites me? What excites me the most is this year we are really going to be focusing on sustaining and expanding our partnerships and collaborations. That is especially including our wellness coalition, which was created last year with Lone Pine and neighboring tribes, neighboring wellness centers in our valley. And I think together, including our local clinic, Toyabe, I think together we can really do some awesome stuff this year, and that is really exciting to me. I don't have any worries at the moment, only because I'm really excited, and I've already found some solutions to some of our issues in the past. So we will be focusing on diabetes prevention, and the way we're going to do that is through partnerships and collaborations, and of course, educational media for awareness. And that's about it.
Nice, Mariah. Thank you so much. If I could have someone from Bear River introduce yourselves. Anyone on from Bear River? Okay, so we are going to move on to Miss Linda Lawson from Manchester Point Arena.
Hi, my name's Linda Lawson. I am an enrolled member of Manchester Point Arena Band of Pomo Indians. I am the project lead. One thing that excites me, I'm hoping that we could raise awareness in our community about diabetes. As we all know, that's big in Indian country. And one thing I am worried about, maybe the feedback, the participation from our small community. Thank you.
Thank you, Miss Linda. If I could have someone from Cloverdale.
This is Darlene from Cloverdale. I'm the project lead for our ACORN program. We're focusing on diabetes type 2 and obesity this year, and we're really happy to have ACORN back.
Nice. Ben, do you want to introduce yourself? All righty, so we are going to move on to Big Valley, Miss Kristen.
Hello, my name is Kristen Amparo. I'm from Big Valley Rancheria. I'm our Boys and Girls Club CEO, and I'm also the ACORNS project director. We're excited to be able to continue with ACORNS, to continue to provide the services that we have been able to and expand on those services. As far as our worries go, right now, I don't believe we have any, but that doesn't mean they won't arise as we continue throughout our year. Thank you.
Thank you, Miss Kristen. How about from Moortown? Mr. Calvin or Benjamin, are you on the line? Okay, so we will move on to Elam Indian Colony. All righty, how about Fort Independence? So I have a couple here in the chat box. I have a Miss Erica Cooper from Bear River Band of Ronerville Rancheria. She's on the line. Also, I have Sabrina and Rosalie, and they are from Bishop. They're having some difficulties with the audio. And I see you there, Ben. Good morning, everyone. And we're going to go ahead and get started.
All right, now that we have the introductions, we really wanted to take some time to introduce ourselves and have you guys introduce yourselves to the ACORNS team and to other ACORNS participants. We like to do this because we want to try to like support or increase collaborations within Indian country that's working on the same type of issues. So I did mention, or I did hear some of you guys mention you want to increase your collaborations and work with your tribal health programs or vice versa. And I think that's amazing. That's something I'm excited about. And I did hear a little bit of worries in there, but not to worry, the ACORNS team is here for you. So for any of those worries that you guys have, feel free to submit TA requests to the team. You can submit it through the crib.org website, or you can download that TA request form that Julie sent you guys in the email, just save it to your desktop and hit your easy button every time you need it. Send it over to Julie, and she'll get it over to the right team member to assist you. Like if it's an evaluation, she'll send it over to Farine or myself or her, however is most appropriate. And for those of you that are losing power or having a little bit of power outages, this webinar is going to be recorded, so we try to accommodate for these type of emergencies, because sometimes it happens where it's out of our control, and we can, go back and rewatch the webinar or submit a TA request, and we'll help you with your questions. So I'm happy to have officially met everybody. Let's go over the overview. So for the rest of the time, we're going to be going over some of the timeline, required documentations that you have to submit for your first payment, also known as the first deliverable, how to make revisions, all the different grant deliverables that we have based on your tier. It's a little bit different this year. There's some different tiers to go over. That was not the case last year. So for those of you that were on, there is a little bit of changes. Some group expectations that we'll have for you guys and that you guys can expect from us. And then we're going to talk about some of the different trainings, webinars, and conferences that we'll be planning for the year. And Farine will be going over the training needs survey. So these are your grant deliverables. I hope everyone can see the screen okay. So there's 3 tiers for our grant this year. You guys all identified which tier you applied for in your application. So if you're in tier 1, you just follow that column down, and those are your requirements for tier 2 and for tier 3, and the dates that everything is due. So I know this webinar came a little bit quickly, but we wanted to make sure we got this information to you guys as soon as we could. So with that said, I can hop right back onto this slide, but I know that there's a lot here. I can go over all of it, or we can hop on to questions that you guys might have that are just burning questions. Okay, so I'll go over the slide, but go ahead and stop me here because there's a lot of moving parts this year. So for this first deliverable, you'll need your signed subcontract agreement, you'll need to identify your project staff, and you'll be getting all of this in a package really soon. It's been sent out before, but we'll resend everything so you have it fresh in case it got lost in your email somewhere for whatever reason. That's going to essentially be a staff roster that you guys identify who's going to be the person responsible for day-to-day activities, and a lot of this stuff was supposed to be included in your application, but it'll be in a table format, really easy to follow. And then if there's ever any changes or staff turnover throughout the grant year, you would just update those and go ahead and send those over to Julie, and then we can update our contact sheet, and we'll know how to navigate those changes with you guys, because it's important for us to know if there's any changes and support you with anything that you might need. You'll need to attend the ACORNS introduction webinar, which is here today. Great job for you guys. One more checked off your list. There'll be the training needs survey, which we'll go over at the end. And I'm going to go ahead and share my screen with Farine when we get to that slide, and she'll go over that with you. There'll be an internal work plan. This is for tier 1 only. And so that'll be, you guys submitted a work plan with your application, and that is what you guys plan to follow. But this internal work plan for those of you that are tier 1 will basically be how you're going to be achieving those items listed in your work plan submitted to CRIB. So it'll really help us understand how you're going to go about things and provide the best assistance we can when you guys run into hiccups, or if you do, or if you don't. If you don't, that's awesome. Great for you guys. And then there'll be the baseline project strategy indicators, from Form B. If you remember from your application, we had asked you guys to fill in yes or no, whether or not you could access some of those records, like for example, diabetes or hypertension, that kind of stuff. And some of you guys put yes, you can on all of them. Some was a little bit more difficult, or it was left blank for whatever reason. So those will be needing for that first deliverable. And if you guys have any questions, we can help you with any of that. So just go ahead and submit a TA request to Julie, and she'll send it over to the appropriate parties, probably Fareen Farouk, and we will help you with anything that we may need. So for tiers, that's for all the tiers for the first deliverables. For the rest of them, we can go over as we go through our grant, unless you guys want me to cover them all right now. Or does anyone have any questions in terms of the first deliverables? Those are coming up here pretty soon, so I want to spend as much time as we can on those. If there's any burning questions, we can address to everyone right now.
So in the chat box, we have a request if you could cover them today.
All right. Oops, am I still on mute? Nope. Okay. So for May 4th, may the 4th be with you for those Star Wars fans? No? Okay. There'll be the prepare tool data. I heard a laugh in there. All right. Got people paying attention. That's great. Submit your prepare tool data, submit tribal readiness assessment data. So the tribal readiness assessment will be sent out later for you guys too. And so there's 3 of those. There's 3 versions of it. So tier 1 and 2 will be getting that respective tiers version. Tier 3 will be getting tier 3's version of the tribal readiness assessment. All of them will be getting basically an organizational capacity assessment, or more geared towards capacity, and that is to help everyone identify where their strengths and weaknesses are and where CRIB might be able to help you, or where you might want to seek training. And that, along with the prepare tool and the training needs survey, is really gonna, we wanted to emphasize capacity building a lot in this first year. And then I'm gonna jump ahead a little bit here. So if you go down to 914, can you guys see my arrow on your screen? Or do you just see the regular screen? Okay, so submit priority strategies and outcomes years 2 through 5. That is for every single tier, and that's basically gonna be a document that will have you guys share with us your vision for what you would essentially want to do over years 2 through 5. That's not an application. That's not a guarantee that there will be some kind of funding years 2 through 5, but it shows us that in year 1, when you did all of these things, the prepare tool, the tribal readiness assessment, they're all for a reason and a big vision. So the year 1 is really going to be geared a lot towards this. And then you guys also have your identified things in your work plan. So you still have to do those, for example, if you're doing a community garden, or if you're working on diabetes, there'll be all those things that you still have to do in your work plan. So where are we here? Sorry for skipping around a little bit. Submit updated project strategy indicators. So in this one for Form B, those are due on the 24th. If there was any that you couldn't, because you identified yes or no, right, on your application, those that you identified no, if you need a little bit more time, we can extend for those no's that you put down, those can be updated on May 4th. And that's for tier 1. So covered tier 1. Any questions there? If you have any questions, I'm just going to roll these out really quickly. But if you have any questions, just type them in the chat box, and then Julie can let me know that there was a question. I'll move on to tier 2 for the May 4th. So the required items for your deliverables for tier 2 on May 4th are complete 1 check-in call. Actually, that's for everybody. Everyone's going to have check-in calls. We wanted to reduce the burden on you guys to have to report so much. The last ACORNS grant had much more reports. This year we're using more check-in calls and just semi-annual report and a final report. So those check-in calls are really, really important. And that's why they're required as one of your deliverables. So we'll be going over everything that you have done so far, everything you need to do, any help that you might need, or any staff changes. Any of that stuff's all going to be covered during these check-in calls. So those are really, really important. And we'll be following up with you guys to schedule those before this. Or if you guys want to request your check-in call, feel free to send it via TA request, and we'll have our check-in call, and we'll track that, and we'll check it off for you guys. But we will be monitoring and tracking to make sure everyone had these check-in calls for the completion of that deliverable. So there's a prepare tool data, and there's the travel readiness assessment, which I talked about also a little while ago. And there is the annual report, or the semi-annual report. Complete for, okay, so we're moving on to tier 3. Complete 1 check-in call as well, submit your travel readiness assessment, and submit your semi-annual report. Moving on to September, these are the last deliverables, or the last set of deliverables. So if you see these 50%, 25%, 25%, that's the way it'll roll out. You get 50% in the beginning, then 25% for the semi-annual report and that set of deliverables, and then for your final report and that set of deliverables. Okay, so starting with tier 1 again for September, you'll have to do your next check-in call. You'll have to submit your final report, and your final report and your semi-annual report, those things will be sent out. They'll be covered. And if you have any questions with those when they do, just go ahead and let us know. So you'll have to submit a community resource guide. This is true for all the tiers. So tier 1, 2, and 3, everyone is going to make a community resource guide, and you're going to want to base these off of those tools that you have already implemented in either your tribe or THB, which will help you identify some of the barriers for your patients if you're tier 1, or your community members if you're tier 3, so that if there's anything that you need to work around, some barriers, like if you're trying to recruit a bunch of people to your new diabetes prevention program or whatever the case may be, but you're having trouble getting people there. I heard that as one of the worries during our introductions. Hopefully by the time you make this resource guide, you've been able to identify what those barriers are, and perhaps there's something in place already that you didn't already know about for transportation or whatever the case may be, to help navigate those barriers or navigate around those barriers. Okay, so that's the community resource guide for all 3 tiers, and we will be sending out guidance on this as well. Submit documentation of completed trainings. So you'll have to, like, this is a documented required training. This is one of them, and Julie's got that marked off. And at the end of the webinar, we'll be launching a poll. It'll just have you, it has some pretty standard questions to answer, and we'll be taking roll using that evaluation poll at the end also, and that'll count as your attendance for the training. A little bit further down the slide, I'll be going over some of the prepare tool trainings for tier 1s. Submit documentation. Okay, so complete health communication strategy and capacity. We actually tried to simplify that for you guys, and we rolled that into one of the tribal readiness assessments. So we will be adjusting that accordingly. Documentation of 2 health education screening events for tier 1s, and submit updated project strategy indicators. So you'll be submitting those in the beginning. You'll have your baseline for this is for tier 1s, right? And then say, I don't know, 100 people in your community have diabetes, then you'll submit, or at risk for diabetes, whatever the case may be. Then you submit your updated ones that'll give us an update on the ones you've already reported on, and ideally all of the other ones that you said you weren't able to report on. Then at the end, you'll give us that final report. And what we would like to see is if diabetes was the project you were working on, is much less diabetes in your community. So that's kind of the point for those project strategy indicators. So moving on to tier 2 for your deliverables in September, I've covered the check-in calls, the final reports, the community resource guide, and your priority strategies and outcomes for years 2 through 5. You'll need to submit documentation of your respective required trainings. And a lot of those will be on February 6th, which I'll cover down the couple slides here. So tier 1, you guys received a required trainings guide in your application packet, if I'm not mistaken. If not, we can send that to you. And if you have no idea what that is, just let us know and we'll send it to you. Submit a TA request or contact Julie. And it outlines tier 1 has a couple of things they have to complete, tier 2 and tier 3. And we'll need documentation of those trainings. And you'll need your, the health communication strategy and capacity assessment. Again, we rolled that into the tribal readiness assessment, and you're already required to submit your TRA is what we're calling it. So that'll be completed that way, and we'll check it off of our list. Moving on to tier 3 for September, we went over the check-in calls, your final report, your priority strategies, your documentation of trainings, and the communication strategies and capacity assessment, documentation of implemented strategies. So basically that you've completed the stuff you said you would do on your work plan. And those are through your final reports. Okay. Long and winded, and any questions now, or a little bit blurry, or should we move on? Do we have anything in the chat box, Julie?
Nothing in the chat box right now.
All right. Well, we'll have times for questions at the end again. I just wanted to make sure I left plenty of time for questions during this webinar. All right. Group expectations.
Hi, Margie has a question from Bishop.
Sure. Go ahead, Margie.
Well, I'm sure you're going to cover it, but were you going to talk about the training there at Crib that we're all supposed to go to?
Yes. Yes. And there's been a little bit of changes, so I have a slide on that. I just wanted to use that first one to give everyone the big picture of what you're required to do. And really, based on your tier, you just kind of follow that column all the way down, and that's your deliverables. But we had it on a big sheet to be able to show all the different tiers what's due. And I'll cover your question here in I think 2 or 3 slides. Okay, so group expectations. What can you expect from, or what we expect from you is timely responses. I'm sorry, there we go. My screen's kind of glitching again. So what can you expect from us is timely responses, appropriate trainings and technical assistance, and we're really pushing that TA request form. And Crib has a general one for all kinds of stuff that you guys can submit to Crib, but for this grant specifically, we have our own, and we're really committed to helping you guys with anything that you need, because the more you guys succeed, the more we succeed, and the healthier our communities are. And if that's our goal, then we really have to try to be there to support anything that you might need. So
Ephraim, is Miss Carol, are you still on the line that you can give them a little bit of what they could receive from that Crib TA request?
Sure, I'm here. Just a couple of things. both through the ACORNS technical assistance request. I'm here to help you in any way I can respond to the needs that we're asking of you in anything regarding your grant. And then in addition to that, we can send out the CRIB technical assistance request, which allows you and your organization or your tribe to receive other types of technical assistance, whether that's planning, program development, grant writing, anything along that line. There's a variety of things listed, fund development. You can send that back into me, and then I'll set up a plan with you to be able to address those needs.
And Ms. Carroll, where can you find that TA request?
I'm going to have email them out to them. We don't have it on our webpage yet.
Okay, all right. And if you can send that to me, I can also send it out to all of them.
That's what I'll do, Julie.
Thank you, dear.
Thank you so much. What a great way to start off the webinar here. All kinds of different resources. Hope you guys are excited. So that was the others part here in this here slide. A little bit of a surprise. From grantees, we expect timely submission of your grant deliverables and timely communication with us. So if there's any changes in your scope of work or any barriers that are preventing you from completing your work, we'd like to know those as soon as we can so we can try to help you still meet all those deliverable deadlines, or help you implement your program, or just evaluate your program if that's what you want to do, or maybe reach out. A few times I've gotten some requests that people are like, I don't know, like, is that like, can I ask you that? And I'm like, dude, of course you can. You can ask me pretty much anything. The worst that'll ever happen is that I say I can't help you with that, or I don't have time right this second. Let's schedule a call. But it's appropriate to ask us anything about your grant, and we're happy to respond. If we're ever on travel, we will have one of the other team members respond to you, but we'll always do our best to get back to you guys. And then we do expect you guys to let us know what your changes in staff are. That's kind of the purpose of that roster that's due on the 24th. And ideally, you guys have already lined those out in your application. This is just a more clear-cut way, and that you can send us updates and we have a place to store it. So circumstances which are preventing you from meeting your grant deliverables, and any training needs or technical assistance requests. And we will be having trainings that are kind of based off of the training needs survey that we'll cover here at the end, which ideally would identify where there is the most need for training, kind of based on your area. All right.
I would like to expand on that just a little bit as well. This is Julie, and the reason why we're asking for those things in a timely manner is just because when we have to get payments out to you guys, as well as if you have staff turnover or changes, that I know that I'm contacting the correct folks. And what we really like to do with our team, although we're small and mighty right now, we always try to have one of our team members on site at all times. So in the event that you have questions or concerns, that we always try to keep someone on site.
Thank you for that addition, Julie. So conferences and trainings. Some of these are not necessarily directly your ACORNS like deliverable. As you saw, the deliverables were listed in that first slide, but they're either very appropriate or joint conferences. So February 6th, this is a big date that I hope all of you have on your calendar, because it's the full day training. We had let you guys know that the 5th and 6th should be reserved for the ACORNS kickoff training. This was going to be a in-person training, but it is now changed to a virtual training. So it will all be online, and you'll have a virtual classroom much like this, but with different presenters coming in and out of the presentation, and we'll be sharing screen, and they'll all have post tests essentially that you guys will have to fill out, that'll confirm attendance, and I'll be on the entire time. So much like we know who's on right now and Julie's been monitoring it, we'll know in that way. There will also be for the tier ones, I think for the tier ones and twos, just check that deliverables required trainings, which we can also send out to you if you have questions. Looks like tier ones. There'll be some additional trainings that you guys will have to watch online before this live training, and I'll go over those here in the next slide. But that's the ACORNS kickoff training. It's on February 6th. It's full day training. It's online. And you guys are required to be on that call. If you have any changes or any special circumstances, please reach out to Julie. She's our outreach person. You can send a TA request or you can call her. But ideally, we want to do all those TA requests because you'll still be required to do it if you aren't able to attend on February 6th for whatever reason. It's just going to require a little bit of navigating for whatever the situation that you have is.
Since a lot of our trainings are going to be virtual from now on, if there's anyone that is in need of a video cam, if you could please type it in the chat box, I can make that happen.
Thank you, Julie. So March 24th and 25th, we have the CTEG data evaluation and grant writing training. CRIB hosts that every year. Well, not every year, but we hosted it last year for sure, and we're hosting it again this year. And that's really going to help all of you for several different projects that you might have, because data evaluation and grant writing is pretty much every one of our programs here. And I think Carol might be on that one. She was on the last one, but she'll be doing, I know last year she did a really great presentation for grant writing. So we encourage you to attend that one. We also put it on here because we wanted to acknowledge that if we're going to have some kind of regional or annual training, we didn't want it to overlap with these trainings that CRIB hosts every year. Because then if, you know, you're either going to miss a deliverable or like attend this conference. So we wanted to put those on your radar and let you know that we're aware of them too, and we didn't want to include those for scheduling conflicts.
Ephraim, could I ask a question?
Yes, ma'am.
I'd like to know from the participants at this conference if they felt it would be valuable to have a sort of one-on-one meetings with folks to answer questions about a proposal that they were currently writing, or one that they wrote and didn't get funded, or general information. I'm considering having one-on-one meetings, and I'm just wondering if you feel that would be beneficial, if maybe you could respond in the chat box and Julie can let me know.
Sure. So if any of you guys want to type that in the chat box and just give a yes, I would love that answer, we can just tally them up at the end and send those over to Carol if you'd like, and we can pass that on to the planners for that particular conference.
Which is also me. And so a few of you might be getting a phone call from me in regards to, we are going to be doing some physical activity. I'm just trying to put a bug in your ear right now. Daniel, Mariah, Lorena, Rosalie, just saying.
Bug inserted, I guess. So there's April 1st and 2nd. That's the Cancer Survivorship and Wellness in California Tribal Communities. There is essentially a wellness conference, and we'll be having that too. We might end up having that be a regional training as well for some of the people in the area, and we'll be reaching out to you guys on this soon, but we just want to get these dates on your radar, and then we'll give you more information about them later if they're relevant to your region or your area. And then June 2nd and 4th, that's when we're planning on doing the ACORNS statewide training, and that's in development. We're hoping to do some pretty cool collaborations, but the ACORNS kickoff training on the 6th, that's virtual now, and some of you guys had allocated some funds for that, and so we're asking that you guys still leave some funds for travel for training, because we still have the ACORNS statewide training, but we don't necessarily have all of the topics for that because we're waiting for the results from the training needs survey that you guys are going to fill out and your tribal readiness assessments. Does someone have a question, or is it just not muted somewhere? I don't want to keep on going if someone had a question. Okay.
I actually had a comment.
Sure.
Okay, so just as to kind of give you a reference of where these trainings are at in case you're thinking about them, geographic wise, the Data Evaluation and Grant Writing Conference is being held at the Black Oak Casino in Tuolumne. And then the Cancer Survivorship and Wellness in California Tribal Communities is going to be held in Southern California, and it has an update for the dates. It's actually March 31st through April 2nd. And so the first day we will be hosting the regional training component for those of you in Southern California, and then also possibly the service area up in Toyabe, which includes all of you members from the different tribes in that area. And so we'll be sending out information on those separately.
Thank you, Kathleen. All right, so I'm gonna go ahead and move forward here. So regional trainings, that kind of leads us, it's a good segue into our regional training. So we've divided our grantees into 4 general trainings. So it might be 3 if we combine some of those regional trainings. And we'll have at least 1 per region. So those of you that are kind of like in the Bay would be 1 region. Those of you that are closer to Sacramento or Roseville area, another one, then like Owens Valley, and then down in Southern California. And I'll show you guys the map here in a second. The training topics will be identified by each region, again, based on the training needs survey and the tribal readiness assessment results that we get in. And we might be sending you guys a poll to choose between, say, if there's like, 3 identified topics and all 3 are tied, we might just ask you guys which one you want. Or if it's pretty clear that there's, I don't know, like grant writing or I don't know, diabetes, whatever the case is that we get the results from. So we'll be in communication about that. This here is a pretty general map of the regions in the area who will be included in the regional trainings. And ideally, we would like to have the tribal health programs and the surrounding tribes all in the area. And we want to promote collaboration between those people. And webinars. I'm going a little quickly here because we're a little bit pressed on time. I don't mind going over if you guys are fine, but I want to respect everyone's time. So I'm going to try to speak as briskly as possible. So these are the ones that I was talking about earlier that have to be completed before February 6th. They are for your tier 1s and tier 2s, I believe. I have a paper in front of me. Prepare Tool 101, implementing Prepare Tool, and the 1 other additional trainings. These are for tier 1s and 2s. So you'll be trying to navigate the Prepare Tool on your own at some point within your EHR systems, which will help all of you navigate. But before we have that training, we want you guys to watch these videos to get a really good handle and be prepared for the live training. We have someone from NextGen and someone from RPMS that are going to be doing the live training on the 6th with you guys. And during that time, they'll be able to answer all of your different questions, and they'll give you their contact information so that you can keep working with them if you need additional help, or you can reach out to us and we'll put you into communication with them. And where you can access these webinars is right here. In the interest of time, I'm not going to click on it and walk through it with you guys, but we can send you this link if you need it. It's NACH or NACHC.org, and just find their prepare links. And these are the titles of the webinars. These are what you will have as your required training. So I know it looked a little bit scary to have 10 whole trainings all at once. You're like, oh, is that 10 different days? So we've set it up so that February 6th, you're going to have 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, at least 5 of these trainings. That's for all of you, tier 1, 2, and 3, covered in this day. And so we'll have the social determinants of health, some data collection by one of our epidemiologists, El Nino Guarino, evaluation and reporting by Fareen Farouk. That's where I'll be explaining a lot more about the tribal readiness assessment and how to implement it, and how each tier is required to do a little bit different ones, and also a lot more of what the purpose behind it is. And then we'll have Emmanuel Yenieb, I hope I'm saying his name right, but he's the one that's going to be doing the live presentation for the Prepare tool, and Kite Castillo here in-house at CRIB. He's on our IT department over at the Health Systems Development Department. And they'll be walking over the how to use them in NextGen and RPMS respectively. And then later we'll be having team-based care. There's actually an update on that. It's not to be determined anymore. We have a presenter for that. Later in the year, if you were on ACORNS before, there was like monthly webinars every time. This year we want to keep doing that. And so how our plans are rolling out right now is that we'll have each one of the strategies. We'll have a presentation April, May, June, and July. These might change, which is why they're to be determined if we get the results back from the training needs survey, and there's some really something that really sticks out to us that needs extra attention. We might just do a webinar on it for everybody, and we'll change these training topics. Okay. Technical assistance and other communications. We've kind of covered this a little bit by now, but for sure there's 2 ways to do it. There's that fillable PDF. You can print it out and scan it and send it in, or you can email it to Julie, and you can find it on the crib.org website. Just click on the ACORNS tab. So you'll go crib.org, programs, ACORNS, technical assistance. It kind of sounds like a lot of steps, but it's not that bad if you follow the website. It should be okay. We've got a little bit of time here left, so I'm going to pass it over to our evaluator, Fareen Farouk, and I'm going to try to share screen with her, or maybe she can take over.
Thanks, Ephraim. So I'm talking about the training needs survey. We sent out an email I sent out an email on January 6th to hopefully everybody with the link for the training needs survey. If you have not received that link, if you could let us know so we can send it to you. It is required as part of your first deliverable. So I really want everyone to be able to have the link. And I will just go over it really quickly too. But through the ACORNS program, CRIB will be providing training and technical assistance to all California tribes, tribal health programs, and urban Indian organizations. The trainings will focus on implementing the evidence-informed and culturally adapted policy systems and environmental changes in order to prevent obesity and commercial tobacco and support commercial tobacco cessation, and support clinical community linkages for type 2 diabetes prevention, heart disease prevention, and stroke prevention. So the results of the survey will be utilized for us to determine the training needs and provide those trainings for your tribe, tribal health program, and urban Indian organizations. So I will quickly take over so I can show you what it looks like. Oh, Ephraim, you have to stop sharing your screen so it'll let me share.
I'm working on it.
Okay.
You got it? Thank you.
Can you guys see it?
Yes.
Okay, so this is what the training needs survey looks like. We have instructions on the top that tell you who should be taking the survey. We would like most staff to take it, and we want everyone, every organization can take more than one. So one person should only do it once, but many people from your organization can take the survey. And we're hoping that senior center staff, temporary assistance for needy family staff, medical staff, public health staff, Head Start staff, and community health representatives are able to take this. So we do ask for your current role and position. We are not asking for your name. It is anonymous, but we do need to know where you work so we can ensure that all of our sites have completed the training needs survey. And most of these questions are about your learning style and what you feel most confident about. And they are on a Likert scale, so you're able to answer your confidence level per each question. And it's not that long. It's just a few questions. And at the end, we ask you to provide any additional comments that you may have that I haven't covered in any of these questions. If you need extra assistance on going over any of it, or if it's not working for some reason, please submit a TA request and we can work with you on that.
We have a comment in the chat from, I believe, Ben Macias saying that he would like you to send him the link.
Okay, I will make sure that I do that. We need to make sure that we have the right email address as well. So in case I did try to send it and it bounced back.
Thank you.
Is there anybody else that hasn't received the link?
Darlene. And Julie can get us those emails. She actually has those, so.
Okay.
Yeah.
Yeah. Okay, I'm gonna stop sharing my screen. No. There we go.
All right, can you guys see my screen again? Yeah. Okay. Thank you for that, Fareen. We will proceed. But really, it's just questions, comments, or concerns from our wonderful ACORNS grantees. So we left plenty of time for questions here. If you would like me to revisit any of our slides, or you have any questions or confusion or anything, now's the time to ask. And again, this will be recorded, so if you want me to go over something and then replay it after we've sent you guys the link for the recording, you can use that as a reference also. If you want, Julie, we can go over anything that might be in the chat box right now also, or if any of our grantees want to just unmute themselves and go ahead and ask.
So pretty much everything in the chat box, I have already been sending private emails back and forth, so they've been addressed.
All right.
Just as an update, and I know that things are coming fast, and we announced the funding was delayed and stuff, and part of that was internally here, the Christmas holiday. So I'm sure happy that we put these dates in your application so that you already had them reserved. But with that being said, then we're having a little bit delay in the rollout of the emails for your subcontracts. And so as stated in your emails, Patty Stern from our finance department will be sending out those subcontracts, and it will be through email. I have spoke with her, and she will be sending it out to the authorized signature and also the lead person that you identified on your application in order to ensure that it gets there, because I know some of you as the leads are the ones taking it to your CEO or executive director or and so that has been corrected, because we know with some of the funding announcements that it didn't go down the chain, and that happens here also, so we recognize that that was a problem. And then all the documents that are due in your first deliverable, in addition to the signed subcontract, we will be sending out in one email so that you'll have all of that in one place for you to see, and that will go out to the lead also so that you'll have that information. If some of your leads have changed, or if that person is out for any extended time, if you could email Julie so that she can make sure that that's emailed to someone that's working right now, that, you know, in case anybody's out, that would be awesome, so we don't have any delay in that sense either. And our hope is to have these emailed out by the end of the week. I need to do another check-in with finance to see if that's still happening, but that is the hope.
Thank you for that, Kathleen. If there aren't any other questions, I think I might just want to share my screen real quick and share that page for the required trainings, just to give you guys a reminder of what it looks like, and the priority or project strategy indicators sheet. Is there
I have one question. Yeah, Daniel over here at Riverside. So for the February 6th, I kind of got confused. So is that an in-person or is it online for all day, correct?
It will be online.
Online, okay.
Yeah, but it's a full day training, and there's multiple topics.
All right, awesome. Thank you.
You're welcome. Give me 1 second here. I want to share that with you guys. Okay, can you see my screen here? It should say project strategy indicators.
We are seeing your notes page, sir.
My notes page. One second. You see it now?
Yes.
Cool. So this is for, oh boy, this is the project strategy indicator sheet. Just a reminder for you guys. Some of you guys filled out maybe the first one and the second one and then put no for the rest. And so we'll have to work with you on those. But for the 24th, we'll have the ones that you guys marked yes or no. And then bear with me here. It lags a little bit when I share screen. These are the required trainings. So we'll be keeping track of these here. And a lot of these here trainings that were the 10 required trainings, a lot of those will be on February 6th on that virtual training. So you guys are required to attend, but we took a lot of the pressure off and put them all into one package pretty early on so that all those trainings and all that information can be used throughout that first year. But I just wanted to put this out, and you guys should have this. It came out with the application package. But I just wanted to give a refresher since there was a lot of attachments that came with it. Okay. Any questions?
I just wanted to mention something about the project strategy indicator sheet. So we are asking for everyone to complete all portions of that, not just the project strategy indicators that are related to the strategies you've chosen. And that's because a lot of these strategies are interrelated. So it is important for us to get a good snapshot of everything in the beginning. For most, just chose to leave it blank, and that's okay for now, but we are asking that you fill in those numbers because that is very important. So if you have any questions, we are here to answer them.
Can they hear me? Yeah, now you can.
Yes, we do.
This is Margie. I think the reason they're blank is because it just says for tier 1 only at the top of that page.
Yeah. So that was directed to tier 1 applicants. Sorry about that.
Yeah, sorry. I forget to do it too, but yeah,
So
that's
which one of those reports is this form?
I'm sorry, can you?
With the form you guys were just talking about? Which one is the training needs survey? The training. Oh, that's the training needs survey. Okay.
Are you a tier? What tier did you apply for?
We're a tier 1.
So the project strategy indicator, is that what you're asking about?
No, I was just wondering which of the reports due is it? I'm the grants accountant, so I do all the report tracking and making sure we're in compliance. So
that project strategy indicators worksheet is actually not a part of the report, but it is due with all the data for the first deliverable, and then we asked for it to be updated for each deliverable.
Okay. Okay, so it has to be, it's due with the deliverables. Okay.
Yes.
Okay. All right. Thank you.
Okay. Do we have any other questions? Can you guys see my screen again? It should say thank you and our contact information. Yes? Okay. So this is our team as we are now. You can contact any one of us at any point in time, really. But you could submit a TA request to Julie and she'll get it to the appropriate party. But always, if you have something pressing or you have a specific question for me, you have my email and my extension, or any of our emails and extensions, or you could just call Crib and ask for us by name, and her name will be Rita, usually on the phone. She can get a hold of us. Okay, and with that,
I have one more thing to add. So this is Julie. Basically, in a nutshell, if you guys need anything, you have questions, any concerns, questions, anything you need, do call or email me. I will make sure it happens. I have also made sure that for the folks, like what Ms. Kathleen was saying, that the emails were sent out with folks that had the signing authority. And I also made sure that the folks who are the leads, or I know who are the movers in this grant project, that all of this information is going to be emailed to you guys as well. And if you guys have any questions, you can call me or email me. I'm pretty much on the site, pretty much live here. So call me anytime.
All right. Thanks, Julie. Any final questions before we wrap it up? I think something just hopped on the chat. Thank you. A lot of thank yous. Appreciate it.
Did you launch the poll?
Yeah, I'm going to go ahead and launch that poll right now. Hopefully no one's off yet. I'm having trouble with my computer again. All right, you should be seeing a poll popping up on your screen here, and you need to go ahead and answer that to have it all be completed. Sorry about that. Usually goes a little bit smoother. We have 15% of our attendees.
Just a reminder as well before you get off, if you are in need of a video cam, please email me.
We have about 50% of our responses so far, guys and girls. Some more thank yous in the comments. You're all very welcome to all those that said thank you.
From when are you going to send out the recording?
Should be probably tomorrow for sure. It usually takes like an hour or so to download to my computer and then to re-upload to YouTube. And then when that is done, then we send the link out as soon as it's done. So by the end of today, if not tomorrow morning, first thing in the morning. There was a few people that had some power outages, so hopefully we can get it to them as soon as possible. Looks like we've got 65% of our polls.
Hey, Ephraim, Where do we find the poll at, man? It didn't pop up on my screen.
Oh boy. It should have.
It's okay. On the bottom of your screen, there should be a little bar that says where the chat is, where it says share, and then right next to it in the middle, it should say polls. And then you can click on that, and the poll will come up.
Thank you. I can only resend it if I close this one, but then I'd have multiple polls.
Yeah, we don't have it.
Yeah, even on the bottom.
Corinne, can you send it to him? You're muted still, Freen.
I don't think I can because I'm not the host.
I can email it to you guys right after if you'd like. We know you.
I could. Yeah.
You know, we know you attended. You were on my 5 people that I can see the whole time. So it's a little bit harder for me to see the guests when I'm like the host because I've got the share screen and the control of the meeting. But you guys, I did see the whole time.
Also, Miss Holly and Daniel, when we do come down to that Morongo training to do the wellness component, if there's any possibility, and I'll be emailing you guys, that maybe we could do a site visit at that time as well.
For sure.
All right, awesome. Thank you.
No problem.
All right, it looks like we're pretty steady at 68% of our votes. I'll give a few more minutes here, maybe like 2 or 3 more minutes, and then if we don't have those answers, we'll probably just go ahead and end the meeting. We're likely not going to get them. Let's see.
I'm having trouble progressing past question 2.
Progressing past question 2.
Yeah, I don't know if it's my computer. I can't scroll down or anything.
Did you? There's a little gray bar on the side. Does a gray bar let you slide down instead of using the mouse?
I'm not seeing a gray bar.
Is this Lorena?
Yeah.
Lorena, we can also have Ephraim email that to you at the end if you'd like.
Okay, that'll work.
Thank you, dear.
Thank you.
Daniel, Lorena. Yeah, this is a new Zoom account that we're using, so we have a little bit of different ways of launching these polls now. So it's a little bit of a pilot for us as well. We see a raised hand from Blue Room.
Miss Melissa and Marjorie, yeah, we're done. If you've completed the poll, we are done unless you have any more questions for us.
All right, 93%. Thank you, guys. We're going to probably go ahead and end it there because the other percent is probably the 2 that I'm going to email right now. Thank you, everyone. I hope that you enjoyed our webinar. Oh, 100%. Great. Thank you, guys. Hope you enjoyed our webinar. Again, if you have any questions, please send us a TA request or get a hold of us through email or call. I hope that we have a fantastic year. Have a great day.